My name is Dr. John Krempecki, and here at Cape Fear Eye Associates, I am the specialist in pediatrics and vision development. Today we're going to take some time to talk about children and adults' eye safety while playing sports and while in the household. Here at Cape Fear Eye Associates, we have our experience with a significant number of trauma and eye injuries that are related to injuries regarding sports and in the household. I'm here to tell you a surprising statistic. 90% of these eye injuries were preventable. That means there's something that we could have done, the parents could have done, the child could have done to prevent any type of injury to the eye. Fortunately, for most of these cases, the injuries are minor, but some cases do cause significant problems to the child's sight and can cause the loss of the eye. We'd like to talk a little bit today about what we can do at home and while playing sports to prevent problems that would cause blindness. A majority of these injuries to the eyes are very minor. When we have something coming straight at the eye, there's something called a Menace Reflex, and this reflex forces the eyelids to close to protect the eye, which is just a soft globe, a soft tissue. The bone, the orbital rim, is there to protect the eye. The eyelids close, and therefore there's this protective barrier in front of the eye to prevent injuries to the cornea, which would result in a corneal abrasion, injuries to the white part of the eye, which can break blood vessels and make the white part of the eye look red or fill with blood, and most importantly, preventing rupturing of the internal structures of the eyes, rupturing of the iris causing a hyphema, rupturing of the lens, rupturing of the globe, or a retinal detachment. All of these latter conditions are very severe and need to be evaluated immediately. If a retinal detachment occurs, there are 3 signs and symptoms that individuals need to see, and if they see at least one of them or any of them, they need to come in immediately for an evaluation. The first are flashing lights. If someone would see 4th of July sparklers going off in front of the vision where they do not go away, that is a very indicative sign of the retina being damaged. The second sign is an increased number of floating black spots. Sometimes we see floating black spots when looking into the sun or a brightly lit room, but in this case it's 20, 30, 40 little black pepper dots all over the place. And these pepper dots are what shows us that there could be blood in the retina or bleeding of the eye. Again, another sign that the eye is damaged, injured, and needs to be addressed. The third item is a veil or a curtain or a window shade appearing over the individual's vision. All of these 3 conditions, all of these signs, most likely do not go away. All of them will cause the vision to be very blurry suddenly. Again, these items, these signs and symptoms are very important and need to be evaluated immediately. If the injury is mild, one still needs to have the evaluation to make sure the internal structures of the eyes are not damaged. We do this by putting dilating drops in the eyes. The dilation opens up the pupils so we get a better look in the back of the eye to ensure there's no internal damage or trauma to the eye. Sometimes, and usually 2 to 3 days after the immediate injury, we end up with what's called a traumatic iritis or traumatic uveitis. This causes 3 very classic signs and symptoms: pain in the eye, light sensitivity or photophobia, and increased tearing of the eyes. Most of the time, individuals who do not come in for an eye exam with the immediate onset of the injury come into our clinic 2 or 3 days later for these symptoms. And we find out that they were hit in the eye with a finger or a ball or just scratched themselves when they were sleeping. Again, a minor condition, but something that needs to be evaluated as soon as possible. An increasing number of children are participating in sports at an early age. Many sports have official standards for safety equipment. It is important for parents to familiarize themselves with potential dangerous situations at home, at school, and while participating in sports, to insist that the child use protective eyewear when participating in these activities to prevent future injuries or trauma to the eyes. Some sports in which children should use protective eyewear include baseball, basketball, football, paintball, any racket sport, soccer, wrestling, all forms of hockey, which include ice hockey, roller, street, and field hockey, and lacrosse. I'd like to go through this list in more detail. In ice hockey, lacrosse, and when batting for baseball, a helmet with a polycarbonate shield or face mask should be worn at all times. It is important that a hockey mask be approved by the Hockey Equipment Certification Council or the Canadian Standards Association. Sports eyewear protection with polycarbonate lenses should be worn for sports such as basketball, racquetball, racket sports, soccer, field hockey, and baseball when fielding. Choose eye protection that has been tested to meet the American Standard for Testing and Materials, or the ASTM, and standards that pass the CSA, or the Canadian Standard Association, racket sports. Protective glasses or goggles with UV protection should be worn with snow or water skiing, as they will help shield the eyes from sunburn and glare. There is no current standard for eyewear protection for boxing, full contact sports such as wrestling, or ultimate fighting. We recommend that the eyes are examined on a regular basis to ensure there's no retinal damage or retinal detachments. And standard industries now have made thumbless gloves to try to reduce the risk of eye injury or penetrating injuries. It is important to understand that contact lenses, although improving the vision, the quality of the distance vision, they do not provide any protection for sports at home or at play. It is still important to wear protective eyewear when participating in these activities. The last thing is, there are conditions where individuals have better vision in one eye than the other. In these situations where the vision is so poor that the individual does not have a functional visual acuity, or meaning passing the standard for driver's license with correction, these individuals need to have protective eyewear 24/7. Polycarbonate lenses, a high impact resistant material, is required to ensure that there's not any damage to the better seeing eye that could potentially cause blindness or loss of independence. To provide the safest environment for your children, select games and toys that are appropriate for their age level. There are numerous items that one as a parent can do at home to provide a safe environment for your children. The overall theme is that set the example. Children will follow by your own example, so please be vigilant for when you're using items that could cause potentially eye injuries. As we have discussed here, there are numerous objects that can cause injuries to the eyes. If an injury to the eye occurs, it needs to be evaluated immediately, no matter how small or no matter how much it does not look like the eye was harmed. If you have any questions, we at Cape Fear Eye Associates stand ready to help you with all your visual needs.